Hi, it's Tom here from Running Physio. I wanted to come live this afternoon to talk to you about something that I think is really important for a lot of our athletes, and that's how we can help them with their return to running. Such an important phase of rehab, and often one that's actually neglected, or maybe we don't feel confident to get people back. So hopefully what we're going to talk through this afternoon will give you some useful information that you can use in clinic, help your runners get back quickly and safely to the sport that they love. Now, you'll notice that we put a little link in the headline here. It's also a link in our Instagram bio to a free guide to return to running that looks a little bit like this. Now, this free guide takes you through a lot of the key principles we're going to talk through. It takes you through some clear case examples as well, and it takes you through these 4 key points of return to running that we're going to talk about in this video. So click on the link there, sign up, access that guide for free, and then you can explore that at your leisure. So, as I said at the start here, we're going to look at 4 key points in the return to running process. And I should point out as well that a lot of this process is a little bit of risk versus reward. We can try and balance out the risk with the reward. So if we're going, for example, very low risk, we can go with a very slow return to running process. It's a very low risk of irritating any tissues, but it's also going to be low in terms of the rewards of getting someone back to the sport they want to do and achieving their goals. We can go very high risk, get people to push really hard, push past their limits. And in the short term, that may come with the reward of them being able to run a bit more and perhaps work a bit more towards their performance goals. But the risk is there that we're going to flare their symptoms up and they might reach a point where they have to stop running altogether. So a lot of what we're doing in the return to sport and return to running process is balancing risk versus reward. We should be looking for ways to minimize risk and maximize reward wherever we can. Now, one good example of how we can do this is cross-training. So if we replace painful running with non-provocative cross-training, it could be deep water running, it could be cycling, swimming, rowing, whatever the person can tolerate, we can get a lot of the rewards in terms of maintaining fitness and performance, but without the risks of further irritation for the injury. So look for those ways to minimize risk and maximize reward with your runner. So let's delve into some of these 4 key points for the return to running process. Number 1 is I will start by assessing an athlete's readiness to run and work out, is this the right time for them to be actually trying this return to running process? And quite often here, it isn't just a question of returning to running from not doing any running at all. It's also looking to see whether we can continue running in someone who hasn't stopped, but at a level that's manageable for them. Now, there are a few things that are going to go into assessing this readiness to run. It does depend upon their pathology and stage of injury. That's important. Obviously, someone coming in with acute stress fracture, that's not an appropriate time to be rushing them back to running. Or someone just after surgery, that may not be the time to get them back. So you need to think about the pathology and stage of injury and reason through whether we are at the right stage to bring them back. We may also think about the stage of the season they're at as well, whether actually now, if they've not got any races coming up, they need to rush back into running, or whether they'd be better off trying to build strength, build fitness, and reduce tissue irritation before planning a graded return. Then, as part of our assessing readiness to run, I have subjective questions that I'm asking. Now, this is to work out irritability. This is a really important part of the return to running process. We want someone's symptoms to have a low level of irritability. So that means they're not likely to be stirred up by bringing them back into running. So the questions I'll be asking would be things like, do you get much pain with day-to-day activities? Can you walk for half an hour without pain? Can you go up and down the stairs without pain? If those things are pain-free or of minimal pain, that suggests a relatively low irritability and a better chance of being ready to return to running. If those things are actually really provocative and they're getting pain simply with walking short distances, then they're probably too irritable for that return to running process. Although with every patient, it's always going to be about looking at the big picture here and not going on one particular sign or symptom. So subjectively, we ask about day-to-day activities, walking, and irritability. And then objectively, there's tests that I would do to see if I feel someone's ready for return to running as well. A big part of running that makes it different from other activities is that it involves impact, and it's that that's often provocative for people. So I will systematically test their impact tolerance. So I'll start with light impact, like jumping in place and jogging on the spot. Make sure that's comfortable. A simple measure is like people to be able to jog on the spot for a minute with minimal pain or pain-free. Can they jump in place 10 to 15 reps? Can they bound? Can they hop repeatedly? If they can do all of those things with minimal or no pain, again, that gives us a better clue that they may well be ready to return to running. So that's the first step, looking at the pathology, stage of injury and stage of season, and then looking at subjective questions to determine irritability and impact tolerance to see if they may be ready to return to running. And then one of the best ways to test if someone can tolerate running is with a little bit of running. So I might get them to do a short run, perhaps on the treadmill, 3 or 4 minutes, something like that, and look at symptom response, because that gives us a lot of useful information. Step 2 then is to work out what their run tolerance is. Now here we're looking for an amount of running with minimal pain and crucially without a lasting increase in symptoms. So often we can get that information subjectively by asking how far can you run without pain, or by exploring their answers to find a level of running that doesn't cause a lasting flare-up, particularly a flare-up that goes beyond about 24 hours. So that's about good subjective questioning in most cases to find out what's manageable for someone. But sometimes they may not have run for a little while and they may have a race on the horizon. We haven't got time to go back to square one and do a very graded return to running. So we might need to test what their run tolerance is. And that's where I might ask them to do a run tolerance test. Now, this assumes they've passed a readiness to run testing, they're at appropriate stage to do it, they've tried a short treadmill run. We might then say, okay, well, let's try a slightly longer run and see at what point your symptoms kick in, and use that to guide us with our return to running process. Let's say you manage 20 minutes pain-free, but above 20 minutes, you're starting to get a bit of symptoms around your hip or your knee or wherever the problem is. So let's stick with 20 minutes and then let's start to build from there towards whatever your goals are. So step 2 is determine that run tolerance. Really important for our runners. Step 3 then is plan a graded return to running based on the athlete's goals. And this is also very important as well. It does need to be based on the patient's goals. Someone that just wants to get around a marathon is going to have very different training needs to someone who wants to get a sub 3-hour marathon. So really important right from the very first session with our runners is to know, what are your goals? What are the time frames for your goals? Because we can utilize the time that we've got available and hopefully plan a graded return back to where they want to be. Now, usually with this graded return, I would try first of all to restore the distance, the training volume first, to build some tolerance at easy training paces. Then I might start to bring in medium intensity runs like tempo runs and steady state runs. And then if they're tolerating that, we would bring in interval sessions, shorter intervals with larger rest periods initially, and gradually increasing the length and intensity of those intervals. So it's a constant process of upping the level with their running towards their goal level, testing out to see how they respond to that. And if they're doing well, they're getting minimal pain during without lasting reaction afterwards, taking them up to the next level if they're able to. Now, as part of your planned graded return, I would also encourage you to plan in recovery within that. So typically I will build for about 3 weeks and have a 4th week as a recovery week. So a lot of times with patients when we're at the return to running stage, I'll take them through a 4-week training block that incorporates that recovery week in it. So that's a big part of what we do in the sessions. We lay out the next 4 weeks, when you're going to run, when you're going to rest, when you're going to rehab, when are we going to include your recovery, and we really consider how that's going to build towards whatever their goal is. And then point number 4 is to monitor their response to this training and modify the running where needed. Now, this is really important. We want to try and keep the running at the right level. And there is going to be a bit of trial and error involved in this. And it does lead to a good question. that what is the right level in terms of pain and symptom response. This is the guidance I tend to go with. And this is a slide from Running Repairs Online, our module 5, which is devoted to return to running, to provide some guidance for pain and exercise. Now, there's 3 things I tend to go with here for people to provide them some guidance. Point 1 is during their running, we want them to give them an idea of what is acceptable pain during exercise. So I usually say mild pain, maybe between a 0 and about a 3 or a 4 out of 10 during exercise is fine. But if it's getting more than that, 4 or 5 and above, that might be a sign that you're doing a bit too much. So try and modify your training to bring it down to a more manageable level. Point 2 is the symptom response afterwards, particularly over the next 24 hours. We know a lot of injuries are flared up after the activity rather than during, particularly tendinopathy will react sometimes the next day. So we'll say alongside that idea that we want mild pain during activity, we want symptoms to settle back down to their normal level within about 24 hours afterwards. And I think that's probably a more useful guide, really. Pain during activity may be less important than how quickly it settles afterwards. And then point 3 on our list here is looking at the trend in symptoms over time. Now this is important too. I'm going to allow a little bit more flexibility with pain during and after exercise, providing things are improving over time. If the trend is that they're being able to run more with less symptoms and they're moving well towards their goals, I'm going to be less concerned about short-term changes in pain. If, however, the trend is they're not improving, they're not increasing their running tolerance, they're not progressing towards the goals, I may decide to be a little bit stricter about pain response during and after activity. So those are our 4 key points, just to recap with you. So point 1, we're going to assess that readiness to run to determine if now is the right stage to bring someone back into running or to increase the running they're doing. Point 2, we're going to try and determine their run tolerance by finding a level of running that causes minimal pain during without a lasting reaction afterwards. Point 3, then we're going to plan a graded return towards their goals. So we've got to know what their goals are. We're going to gradually build volume and intensity and frequency towards the kind of level of training that they want to do. And point 4, as we're doing this process, we're going to monitor their response and try and keep the pain at a manageable, mild level during without lasting symptoms afterwards, and hope that the trend is an improvement towards their goals. So hopefully that makes sense. And there's a lot more information about this in the guide, so do click on the link there to access that. There's also the link in the Instagram bio as well if you want to have a look at that. Alongside this return to running process, there's going to be lots of other things we think about with our running rehab. I would bring in the right rehab exercises to address any impairments that we might find in terms of strength, control, or flexibility to improve their capacity and tolerance of running and hopefully have some positive effects on performance. I'd want them to understand their injury really well and understand why a graded return to running is important. I might talk to them too about things like sleep and recovery, because that becomes even more important if we're asking them to do more and more in terms of their training. And then this return to running process can sit within this kind of bigger picture of running injury management. And hopefully if you follow those steps well, you work closely with the athlete, you can gradually build them towards their goals and celebrate with them as they get to the start and finish line of those races that are really important for them. Okay, I look forward to reading your questions and comments. I've seen a few fly in there, so I'll get to those shortly. This video will be kept up for people to access later. We do also upload them to YouTube as well, so do check out our YouTube channel if there's any of these that you missed. We've got some extra ones in there on calf pain that we did recently as well, and there's lots of other things. We've got a nice tendinopathy treatment timeline that you can dive into on our YouTube channel as well. Okay. Take care. Bye for now.